Hello, I am Manavsada Semra, student of Petroleum Engineering Department, and today I will present about the application of fluid mechanics in healthcare. First, I want to give brief information about what is fluid mechanics. Fluid mechanics is the study of fluid behavior, for example, liquids, gases, blood, and plasmas, at rest and in motion. Fluid mechanics has a wide range of applications in mechanical and chemical engineering. Also, we can observe implementation of it in medical area, in other words, in healthcare. The application of fluid mechanics in healthcare is wide, for example, in equipments or medicines. In this presentation, I want to talk about fluid mechanics role in medicines. I mean, how medicines work in our body, in our blood system, and what is their effects. So, when it comes to table of contents, for the first section, I will talk about application of fluid mechanics for defining blood flow of the body. For the second part, I will talk about the role of fluid dynamics in the therapy of cancer. There are a lot of therapies and treatments that we can see the existence of fluid dynamics, but in therapy of cancer, um, it's more wide. And when it comes to section C, I will talk about fluid mechanics on the movement and influence of medicines through the blood. Section A, application of fluid mechanics for defining blood flow of the body. The diameter of a blood vessel can be an important factor. As we can see, this is a blood vessel, and the diameter of blood vessel can be an important factor in determining pressure, since delta P in equation here scales with the force power of diameter. If the diameter of a blood vessel decreases by a factor of 2 and all other factors remain the same, the pressure must increase by a factor of 16 to maintain the same volumetric flow rate. Some medications for hypertension are designed around this principle, and they lower blood pressure by limiting the contraction of blood vessel walls. Of course, a number of caveats and limitations are associated with applying Poiseuille's equation. Here we can see it. Um, describe blood flow in the human body. First of all, blood doesn't flow in a steady manner because it pulses with every beat of the heart. In addition, the analysis behind this law stipulates that the pipe is rigid, but blood vessels are flexible and compliant tissue. Blood is also not a homogeneous liquid. At very small scales, the diameter of a capillary is actually smaller than the blood cells themselves, and those cells must bend and fold in order to pass through the tiniest capillaries. While this equation may not be directly applicable, it nevertheless does provide a qualitative indication that blood vessel diameter and the partial blockage of blood vessels are important factors in influencing blood pressure. Here we can see the circulation of blood in human body. For the second part, the role of fluid dynamics in the therapy of cancer. We can see two types of pills, or let me say medicine, in this slide. First is blood thinners, that's used for mm, people who have cancer, and the most applicable medicine for the people who have cancer, Avastin. When we talk about blood thinners, let us take an instance. For example, patients who have cancer go under chemotherapy to control tumors and people who easily create blood clots use blood thinners, which is a type of medicine to maintain the flow of blood through the body. This is fluid mechanics because it is studying the movement of medicine, calculating around the body. I mean, we have blood. If I elaborate, we have, for example, blood clots. Blood clots is something like gelatin, and they create obstacles for blood to move in vessels, to move in our arteries, and we and people take it, these blood thinners, to make them liquid again. When we talk about Avastin, um, we have for the therapy of cancer antiangiogenic therapy. A cancer needs a good blood supply to provide itself with food and oxygen and to remove waste products. When it has reached 1 to 2 millimeters across, a tumor needs to grow its own blood vessels in order to continue to get bigger. The protein that is made by cancer cells triggers the blood vessels to grow so the cancer can then grow. So there need to be something to stop that blood flow caused by cancer cells, which is and this blood flow we can call this angiogenesis. I mean, they are made by cancer cells. We use uh, angiogenic angiogenic drugs for the treatments to stop tumors from growing their own blood vessels. And if the drug is able to stop a cancer from growing blood vessels, it might slow the growth of cancer or sometimes shrink it. For example, we use Avastin. When we talk about section 3, fluid mechanics on the movement and influence of medicine through the blood. So we use a lot of medicines that make our blood circulation, let's say, relaxed. I mean, it makes it go easily in our body. First, I want to talk about diuretics. Diuretics are sometimes called water tablets because they can cause you to pass more urine than usual. They work on the kidneys by increasing the amount of salt and water that comes out through the urine. Diuretics are often prescribed for heart failures patients and sometimes for patients with high blood pressure. Examples include furosemide or clothalidone. I mean, these two are medicines. Laxatives. Secondly, laxatives. Laxatives are prescribed to treat or prevent constipation by loosening stools and increasing bowel movement. The different types of laxatives work in different ways. The choice of laxative prescribed will depend on a number of different factors. There are 4 main types of laxatives. First is bulk-forming laxatives. They contain a lot of fiber. Second is osmotic laxatives. They increase the amount of water released into the bowels, making them easier to pass. Then we have stimulant laxatives. They stimulate the bowels, speeding up their movements, and so the less water is absorbed from the stool as it passes through the bowels. And then we have stool softener laxatives. Stool softener laxatives can cause more water to be reabsorbed from the bowel, making the stools softer. Then we have antacids. Antacids are also known to cause dehydration because of the moisture they require when being absorbed by your body. Drinking plenty of water can reduce the dry mouth, stomach cramps, and dry skin that is sometimes associated with antacids. The major side effect of them is that they contains magnesium, um, which can cause diarrhea. Uh, but they contains calcium for the health of our body and for the strength of our bones. And lastly, antihistamines. These medicines have an effect on the distribution of electrolytes and salts in the body and to reduce swelling and inflammation associated with pain, injury, and allergies. This can affect fluid balance in the body. Thank you for your attention. That's it.